Welcome to the Tuesday Night IBS podcast hosted by Johannah Ruddy. The podcast connects patients and providers with information and education about the diagnosis and treatment of IBS and related diagnosis. Each month, we feature a new episode with guest experts in the field of motility and neurogastroenterology who share the latest science and data for diagnosing and treating these conditions, as well as conversations about their impact on a patient's quality of life. Just a reminder, the information provided in this podcast is for informational and educational use only and should never be substituted for medical advice. Always work with your doctor to diagnose and treat your IBS symptoms effectively.
Hi, everyone. Welcome to our first episode of our second season of Tuesday Night IBS, the podcast. Can't believe we have already gone through an entire year with 14 episodes in 2022. And here we are with our first one in 2023. And so pleased to be here with all of you. This month, if you caught on to our webinar last week, we were addressing IBS management, medical management, dietary management, as well as behavioral management, specifically focused on the use of gut-directed hypnotherapy and the expanded access for patients for this treatment through the digital therapeutic app called Regulora. And so I'm joined today by two experts in this area, Tim Rudolphi, who is the CEO of metaMe Health, the parent company of Regulora, and also Dr. Sarah Kinsinger, who is a GI psychologist and specializes in gut-directed hypnotherapy with her patients who have digestive conditions. And she was one of our faculty members on our webinar last week, and she gave us a really great overview of how gut-directed hypnotherapy can work. So hello to both of you. Thanks for being here.
Hello. Thanks for having me.
Yeah, absolutely. Excited to be here. Thanks.
Great. Well, I'm excited to talk with you both a little more about this therapeutic. I think first I'd like to start with Tim. The thing that I like the most, frankly, as a patient with IBS, but also as an advocate and educator, is that you went through a full study, clinical study, to validate the efficacy of this therapeutic in a digital format. And then you went to the FDA and you got the FDA to clear this, right, as a therapy for patients. And I know that probably means more to those of us in the audience who work in this space than maybe patients, but why should that be important for patients in terms of efficacy and the work that you did behind the scenes in that regard?
Yeah, it's a great question. And it's critically important to us. From the start, we made a strategic decision that all of our work would be based in clinical science and FDA regulated products. My background is in pharmaceuticals. So I've had 30 plus years of bringing drugs to market that have, just naturally, I think people understand that need to go through clinical trials and through FDA regulation. But it's important here with digital therapeutics, digital health as well. And the reason is really twofold. On the one side, specific to the IBS patient, as you very well know, IBS symptoms can oftentimes mimic those of other GI conditions, arguably more serious conditions. And as a company in this space, it was important to us that the patients who use our product have seen a physician, have confirmed a diagnosis, and worked with their healthcare provider to choose the right therapy for them. Because what could happen otherwise is somebody might believe they have IBS, they try this product, and it delays their eventual diagnosis of what could, again, be a more serious condition, right? And we didn't want to have any part of that. We want to be a part of the solution, the healthcare solution in total. The other aspect of why it's important for a patient that they consider prescription-based products is that we're regulated completely, not only from proving the efficacy and the safety of the product, but the ongoing continuity of the product. And what I mean by that is we've designed this product inclusive of cybersecurity and privacy regulations that the FDA signs off on, right? We cannot change that at all without having to go back to the FDA and restudy and retest and get clearance again for the second time. So from the day we launched it to well into the future, you're getting a safe, regulated product from a science perspective, but again, from a cybersecurity perspective. Other applications that aren't FDA regulated can make changes whenever they want. And I'm not saying that they necessarily do that, but they can. They can make a change to the messages that they deliver, the content that's included. They can make changes to the privacy and cybersecurity components, and you'll never know. You won't know what version you're getting. It's really like taking a prescription drug versus a black market drug, if you would, to some extent. That's maybe a little extreme, but that's the comparison here. And that's the reason why we're in the prescription digital therapeutics business.
Yeah, I think that's a really important point that you make, because, in reality, these treatments are not benign completely. And I think it's important that patients recognize that these are validated treatments for the management of abdominal pain and other symptoms of IBS, and to use them without oversight and safety considerations is like you said, using a drug that hasn't been validated and has no safety record. So I think that's a very excellent point to make. We talked a little bit on the webinar about how even diet therapy is not a benign therapy. A lot of patients think, oh, I'll just look at diet and I'll just restrict diet, or I'll just take an over-the-counter nutrient I buy online or something. And I think a lot of that, it is potentially damaging. So you really have to be careful from a patient perspective and do your homework. And I like that you made that point. Tim, why did the company decide first to look at IBS and target that as a disease state to really focus on with therapies?
Yeah, simple answer. Our founder, Danny Bernstein, is a patient himself. He's an entrepreneur on the business side, but a patient as it relates to both IBS and IBD, inflammatory bowel disease. He's been treated at Northwestern, I think, almost his whole life, 40 some odd years now in terms of being treated there. And it's via his treatment there at Northwestern that he learned about behavioral treatments for conditions like IBS. And from there, his mind kind of got to working that, well, okay, although I have access to this therapy because I live in the city, I live close to Northwestern, there's the vast majority of patients like me, speaking for Danny, across the United States don't have access to this. Right. And then as technology continues to advance along about 2016, 17, he got the idea that, well, wait a minute, we could maybe create a digital application here that delivers these behavioral therapies, gut directed hypnotherapy specifically, so that patients had broader access to this. And that's Danny and I got to know each other in 2017, 18. And when I saw the idea, I thought it was brilliant, and immediately jumped on board. And that's what got us started.
Yeah. I like that. Obviously as a patient, it's kind of nice to know that, that another patient with personal experience is, the driving force behind something like this. It kind of makes you go, yeah, we're all in this together, right? Like that's kind of nice, as opposed to someone who has no experience with this disease at all.
Yeah. Interestingly enough, we're still a small company, right?
Sure.
But about half of us have GI, IBS or IBD. So yeah, it's not just Danny, it's a number.
Yeah. That's fascinating. So, what's on the horizon? Regulora, available now by prescription. Patients can access it even through a primary care physician, not just a gastroenterologist. After, like you said, after a good evaluation. What other things are on the horizon? Other possible disease state therapies?
Absolutely. We're a prescription digital therapeutics manufacturer specializing in gastroenterology, right? GI conditions. We actually now have 4 other protocols, other products in our pipeline for other GI conditions that we're working on. We're very, very excited about everything from functional dyspepsia, functional GERD, inflammatory bowel disease, as well as bloating. So all of these are in our pipeline at various stages of development. It takes time, as you the initial question you asked here, to run large pivotal trials will probably take us 1 year to 2 years for each of those, another 6 months at the FDA. So, but within another 2.5 years, we could have 3-4 different prescription digital therapeutic products on the market for distinct GI conditions.
That's really awesome. We know so many patients with IBS do have overlap of other conditions, both IBD or other DGBI. So this is exciting to hear about. Sarah, Dr. Kinsinger, thanks for joining us again on the podcast. You were one of our faculty presenters on the webinar, and your presentation was so great. It was so thorough to give the background of brain gut behavioral therapies in general, and then gut directed hypnotherapy more specifically. Would you mind just reminding us how long hypnotherapy has been around in terms of its use as a medical therapy, and then when it was first applied to IBS?
Sure. And thanks again for having me and for the opportunity to, delve a little deeper into this discussion around gut-directed hypnosis. It's something I'm really passionate about because I think there's huge benefits to many patients out there.
Yeah.
So, honestly, talking about hypnosis being used for medical purposes, this goes back to the 1800s. There's documentation of surgeons in Europe using this to help patients survive surgical procedures. But in terms of more recent, research on medical hypnosis and its application to GI disorders, that goes back to the 1980s. Some of the first research was done. It came out of Dr. Peter Warwell's lab at the University of Manchester. So I think that's important to communicate to patients and providers that this isn't a new approach, even if maybe they haven't learned of it before or don't fully understand it. It has decades of research at this point being used specifically to treat IBS.
Yeah, definitely. We had a podcast episode in September where we talked with Dr. Ole Paulson, who's been obviously intimately involved in hypnosis for many, many years, a couple of decades, built his career around it. And the North Carolina protocol, if I'm not mistaken, is the one that is utilized most often in gut-directed hypnotherapy for IBS. Is that correct?
That's correct. Yeah. So what Dr. Paul's, he's done such great work in this field and has been a mentor for many of us that are GI psychologists now. One thing that I think was really brilliant in his work was creating the scripted protocol using hypnosis for IBS. And so he really wanted something that could be standardized. And I think he had this vision early on that there's opportunity to disseminate this much more broadly. And so he first did that through creating this scripted protocol, the University of North Carolina protocol, that was tested in clinical trials at UNC, and has been adopted by many clinicians. So many mental health providers and clinical practice use this protocol to treat patients with IBS. And it's the foundation of Regulora as well. So, again, he had this vision of how do we more broadly disseminate this treatment so that it can reach more patients.
Yeah, That's great. Tim, why did the company decide to go with the North Carolina protocol? Was there something that stood out about that as opposed to other protocols?
Absolutely, no doubt. Not to mention, least of which is Dr. Paulson himself. As
Yes.
Dr. Kinsinger said, he's just a fantastic leader in this field. And for us to be able to be partnered with him and utilizing his protocol was important. But as mentioned here, it's really one of the leading protocols and most widely used protocols out there. And being scripted made it much easier for us to build into a digital therapeutic. Today's technology, there are all kinds of AI that we could use to do all kinds of different things, but this just makes it very simple, easy, consistent, not only for the build of the product, but for the utilization from the patient's perspective as well.
And can I just jump in and add to that to say it's something really, I think, helpful about his protocol is that it's subtype agnostic. So, patients can have diarrhea predominant, they can have constipation predominant, they can have these fluctuating bowel habits with IBS. And so sometimes in clinical practice, we'll kind of, customize our hypnosis suggestions to match those symptoms. But with his standardized protocol, he designed it in a way that it would be effective for any of those subtypes. And that's what he's shown in his research as well. And so I think that also lends itself really nicely for this kind of, more standardized delivery method.
Yeah. It's almost like he was forecasting the future when he was developing this. It's quite interesting. Mm-hmm. Sarah, for people who are not familiar with what, let's say, health hypnosis or hypnotherapy is, can you kind of give us an overview of what that involves? I have talked about it with some patients that I consult with, and many of them have a very skewed image of what we would see like at a circus or on a movie where they end up, walking around clucking as a chicken or have no control over their thoughts and body. And it's not that at all. So I'd like for you to just maybe summarize what it involves and how it works.
Yeah, absolutely. I mean, it is unfortunate that, like I said, even though we've had decades of research now, the vast majority of people have this misperception about what hypnotherapy is. And there's a lot of fear around it as well, because of stage hypnosis shows being used for entertainment purposes. People don't want to be made to do silly things.
Right.
But used in clinical practice, it's very, very different. So medical hypnosis, traditionally is delivered by a licensed medical professional. So it could be a mental health professional, could be a physician, a dentist, a nurse. And with hypnosis, we're encouraging the patient to enter into what we call a different mental state, which is referred to as this trance-like state. And so it's this verbally guided intervention where we're encouraging the patient to sort of gain control in this special way, to use their mind to enter into this very highly concentrated state, this trance-like state. And then the clinician will then introduce suggestions to facilitate certain changes in thoughts, emotions, or behaviors that are going to have a beneficial effect on the patient. And these are referred to as post-hypnotic suggestions. And so it uses images and metaphors and messages about these lasting changes we want to take place, even when the patient's not in this active state of hypnosis. And so sometimes I think of it as, this is something the clinician or, an app-based treatment, it's kind of coaching or guiding the patient in entering the state and introducing these suggestions towards change. But the patient is creating the changes. They're very much in control of the process. We think of all hypnosis as self-hypnosis. So it's not something being done to them. It's something they're learning to do. They're learning to harness their mind in this really kind of powerful way. The reason why hypnosis, is kind of different from meditation, different from guided relaxation, is really about those therapeutic suggestions. So when we can get our minds into this trance-like state, what happens is that bypasses our really critical and analytical kind of problem-solving mind we often use day to day. And so when we bypass that type of thinking, our mind becomes more open to suggestion. And so that's really what we're doing with hypnotherapy, is we're trying to really open up that receptiveness and then introduce these suggestions, these metaphors, images about changes we want that individual to experience in a more lasting way.
That's really interesting. Can you give us an example of some of these suggestions? Let's say I'm a patient with abdominal pain, pretty severe abdominal pain. I'm guessing your suggestions for that would be different than a patient who was really just chief complaint of constipation, let's say. So could you maybe give us some examples of how those would vary?
Sure. So when we're targeting pain, we're really focusing on reducing that hypersensitivity in the gut. That's one of the kind of key mechanisms with IBS. There's this visceral hypersensitivity, this overreaction of the nerves in the gut, causing those symptoms to be experienced more strongly. So the suggestions to target pain or discomfort in the gut really focus on things like warmth, whether it's, someone imagining they're lying on the beach and they're feeling that warmth of the sun, and maybe they imagine that warmth gets absorbed into their abdomen and that warmth will stay with them. It will create this sense of comfort and well-being in their gut. And in terms of the post-hypnotic suggestions, I'll say things about how that warmth will be with them in the coming days and weeks. Situations or things that normally would trigger some gut upset will no longer have that effect because they'll be protected by the soothing warmth they're carrying inside of them. I use a lot of images of light, so maybe like a healing light traveling through the gut, and that reduces sensations of discomfort. In terms of more kind of the motility piece, someone with, constipation, we may use metaphors related to something related to movement. So whether it's maybe a river, visualizing the colon like a river, and they can use their mind to adjust the pace of the river, adjust the pace of that movement. And we focus a lot on the body being able to adopt healthy rhythmic movements in the bowels so that things are happening in this more regulated fashion. I may say, there's no holdups, nothing's getting backed up here, just healthy, normal, rhythmic bowel functioning.
That's fascinating. In terms of durability, what are you finding in patients who finish? Is it a 12-week cycle that's recommended through Regulora, Tim?
It is a 12-week cycle for Regulora. 7 therapy sessions are delivered once every other week for a 12-week period of time. Okay. Individual therapy face-to-face, I'm sure, Dr. Kinsinger, that probably varies as to how things. But
yeah, typically it's very similar. We recommend anywhere between 7 to 12 sessions, depending on the protocol we're using. It is meant to be a more short-term treatment approach. And in terms of durability, we have really good data on that from clinical trials. It's really nice to see that when patients do have symptomatic improvement after the 12-week course of treatment, they typically maintain those improvements up to 12, 18 months later. And that's what I see in my clinical practice as well, is, when people have improvements and they're feeling better, I always tell them, you're welcome to come back and see me, and I'm here for you if you need a little tune-up in the future. And occasionally they'll pop in, but oftentimes, when they've learned these skills and they know how to utilize them on their own, they don't necessarily need that follow-up.
Yeah, that's really, those skills endure. Go ahead.
Oh, I'm sorry, Johannah. I'll add to that we actually did a 1-year follow-up from our clinical trial. And exactly as Dr. Kinsinger said there, that the majority of patients who saw relief at the end of the 12 weeks still were seeing relief 12 months later with having no interaction with the application whatsoever.
That's fantastic. That's really, really cool. Dr. Kinsinger, now we talked a little bit earlier about how none of these treatments are benign, right? And there's obviously considerations for who is a best candidate to use a gut-directed hypnotherapy therapy. So talk us through that. Who is contraindicated for this sort of treatment?
Yeah, I think this is an important discussion. I mean, luckily, in terms of safety profiles, psychological treatments are pretty safe as far as treatment for a medical condition, which is nice. Sometimes I joke with patients, like the only side effects you get from hypnotherapy are you may sleep better and have migraines and backaches, lots of positive side effects. But I do think we want to be thoughtful in terms of who we recommend this treatment for. And I think this speaks to what Tim was describing early on around how, this is prescribed by a healthcare provider who has evaluated the patient, had a conversation with the patient, understands what kind of treatment might be the best fit. Typically, we recommend any brain gut behavior therapy, including gut-directed hypnotherapy, for patients who are psychologically stable. So meaning, there may be some comorbid anxiety or depression related to their IBS, because we know that can be just part of the picture of living with this. Yeah. But for individuals that are really struggling psychologically in other ways, unrelated to their IBS, and they're not getting appropriate treatment for that, maybe they have OCD or an eating disorder or post-traumatic stress disorder, and they're not under the care of a psychiatrist, or those psychological issues aren't stable. Typically, we want the medical provider to direct them towards that appropriate mental health care first. And once those issues are stable, then we want to consider including a psychological treatment for their IBS. I think PTSD is one of the conditions we're most cautious about with hypnosis. And it doesn't mean that if someone has a history of post-traumatic stress disorder, they may not be eligible for something like hypnotherapy. Again, it just means it's good to have a conversation with a medical provider, because if someone has active PTSD symptoms, a treatment like hypnosis can increase symptoms of dissociation. And with that dissociative process, sometimes it can bring up some trauma issues for patients. So if someone has a trauma history and it's been dealt with, it's stable, then hypnotherapy, still may be a really great option. But if there's active symptoms of PTSD, we typically would go with a different treatment approach in those cases.
Okay.
A couple other considerations, I think, just in terms of if we want to match the right patient with the right treatment for their IBS, if we're recommending a psychological treatment and something like gut-directed hypnosis, I think it's important for clinicians to understand that, patients need to buy into the approach. They really need to have some openness to the idea that a mind-body treatment can help their gut, and the clinician may need to do a little education around that.
Absolutely.
Because maybe the patient's never heard that. So that could be kind of a collaborative, conversation there. And then also patients need to really understand that this is a self-management strategy. So they really need to be at a point where they're able to commit to, being an active participant in the treatment in this way. So whether it's, meeting with a clinician every 2 weeks and doing their practice sessions in between, or finding a time that they commit to using the Regulora app and doing the practice sessions in between, it really does need that level of adherence to have kind of the best outcomes for patients.
Yeah, absolutely. I totally agree. And if any providers are listening and need some resources for that patient education piece, the Rome Foundation has a lot of great resources, absolutely free. You can download from the website, including the Brain Gut Axis education card, which is a really nice image to help explain the role of the brain and the gut and how behavioral therapies can influence the gut and GI symptoms. So you can find that there. I'm curious about access. Tim talked a little bit about that earlier in terms of, expanding access to these therapies for patients. And Sarah, for those of you that don't know, Dr. Kinsinger and Dr. Kiefer co-chair the gastropsych group within the Rome Foundation. And so I know a lot of your work is trying to expand resources for patients by increasing education opportunities for health psychologists to start treating patients with digestive conditions. But, what do you see on the horizon in terms of accessibility for patients? I think, sometimes I get a little bit depressed thinking about the the need versus the access. Any thoughts on that from your end as a provider and a clinician?
Yeah, so we've come a long ways, but we do have more to do in this area. I started out in 2009 working as a psychologist in GI, and Dr. Kiefer had been in the field even before that. And, at that time, there was we could count on two hands how many GI psychologists there were in the US. And we just saw this great need to do further education to equip more clinicians to treat GI patients. And so that's why we created the gastropsych division, and the Rome Foundation has been a great supporter of us in those efforts. So we provide, continuing education training and workshops for mental health clinicians so that they can feel more confident in using CBT and hypnosis to treat conditions like IBS. And we have a directory where clinicians who've gone through our trainings can list themselves. So through that work, we have seen improvements. It's interesting now, physicians are familiar with GI psychologists, and I think are, often looking for someone in their community, or they want to hire their own GI psychologist because this is kind of known to be a beneficial aspect of care. But even with those efforts, there's whole states that don't have a GI psychologist in the US.
I know.
Yeah. And let alone internationally, how much more we need to do. So, I think this is where we have to kind of attack the problem from multiple angles. So it's exciting to see prescription digital therapeutics as one avenue, and continuing to train clinicians and train GI providers also. And how do you work with a GI mental health provider? Or how do you know when to recommend a treatment like Regulora to your patient? I think that's something we want to continue to focus on, because that's how we're going to get more patients matched up with these really great treatment options.
Yes, totally agree. Tim, the big question that every patient is going to have is cost. How much is Regulora going to cost me? Many of the drug therapies for IBS are scantily covered by insurance, and out-of-pocket costs are very high for a lot of patients. And that's the number one question that I get. So talk a little bit about coverage and out-of-pocket costs.
Well, it's a very important question. And like the drugs, we're working with the insurance companies as we speak to ensure that we can get coverage so that their insurance provider does provide coverage for the product. That isn't the case today. We're hopeful it will be tomorrow. In the interim, though, we understand that. Again, having come from that pharmaceutical background, I fully realize that cost far too often impacts a patient's ability to take therapy. So we've specifically set up Regulora to cost the patient no more than $75. As long as they have insurance. There are legal limitations as to what we can do. But if they have insurance, then and the insurance doesn't cover it, which would be the case today, then they will pay no more than $75.
That's fantastic.
Therapy.
Yeah. I mean, that's just amazing, because you think about, the cost of even just supplements or some other alternative therapy avenues that patients take out of desperation to feel better. And, that's very affordable for an evidence-based treatment.
Yeah,
absolutely.
For too long, access has been the issue, right? The last thing we wanted to do was come to market with solving a problem of access by just creating another problem of access on cost. We've eliminated that to the extent we can.
Yeah, that's fantastic. That's really good news for patients. When I've actually, since I learned that, I've been sharing that with some of the patients that I talk to on a regular basis, and they're like, "Wait, what? Oh my gosh, that's amazing! How did they do that? I don't even care how they did it. That's great." So that's really great. Thank you for that. Dr. Kinsinger, like recommendations to providers, gastroenterologists, primary care, APPs on, gut directed hypnotherapy as an option for their patients, any last clinical pearls for them?
Yeah, I mean, I think it's important to get comfortable talking about these concepts. And I think that the key things are spending just a few minutes bringing up the role of stress, the role of the brain-gut axis, starting to have that conversation during clinic visits is important. And like you said, we have some resources through the Rome Foundation that can help give them some language. There's publications with really helpful guidelines on that. But, that's the foundation for, why you would be recommending a treatment like gut directed hypnotherapy is that, our conceptualization of IBS is that one key component is this brain gut dysregulation. So finding some ways to explain to the patient that there may be a component of kind of miscommunication between these two organ systems that's causing them to feel things more strongly in their gut, causing their gut to be more reactive to stress. And hey, we've got some effective treatments for that. And maybe they don't recommend it right off the bat, but if they start having that conversation early on in their evaluation and in their clinic visits with the patient, then maybe once they finish their clinical workup and they have a firm diagnosis of IBS and they're starting to talk to the patient around treatment options, then it makes sense when they bring up something like gut directed hypnotherapy as a recommendation. They've sort of set the stage, given the rationale, and then the patient has options. They can provide this as an evidence-based treatment option alongside maybe some other things that they think could be helpful.
Yeah, I completely agree with you. And I also think, gut directed hypnotherapy, as well as other behavioral health therapies, should not be the last resort option for patients. They need to be right up there with the medical therapy and or the dietary therapy. I think many times when they are a last resort kind of option or recommendation, that kind of invalidates for patients both the diagnosis and the therapy you're recommending, and further drives this sense of stigmatization that, oh, well, if that's the last resort, then and it's a behavioral health option, it must be all psychological, and that's certainly not the case. And I think by making that recommendation early on, and like you said, properly educating the patient around the rationale and the role of the brain in the gut's symptoms and sensitivities, it makes more sense, and it kind of reduces that sense of stigmatization that many patients feel. So that's a very good point.
Yeah, absolutely. And I think you're right that communicating it early communicates confidence in the treatment.
Yes.
Because you're right, when it comes up, when everything else has failed,
right.
That the patient.
Well, let's try hypnotherapy.
Exactly.
Like, whereas, no.
Yeah, this is an evidence-based treatment, and let's consider it right alongside some of these other treatment options.
Yeah, I have to believe, a lot of that also comes just from the access issue that we discussed. That look, I don't, as a physician, I might not have this top of mind, the first thing I want to use in a world where I can't use it. I have nobody to refer you to the first place, so it automatically becomes a last resort. But now with the growing numbers of GI psychologists, the opportunity to use prescription-based digital therapeutics that can deliver this, particularly as you'd mentioned, Dr. Kinsinger, with the safety, the general safety profile of this type of therapy, it really should be considered upfront to a much greater degree than it has been historically.
Yeah, I 100% agree. Dr. Kinsinger, for patients who are still on the fence, any words of wisdom to help them just give it a try?
I hear from patients so often how much they enjoy the treatment. That not only is it helpful, but they just really enjoy it, that it's something really nice to participate in. Our primary goal is treating IBS and improving IBS symptom management, but it's nice to take time for ourselves out of the middle of the day,
right?
and visualize really pleasant, calming images and learn to relax our body and manage stress in this new way. I have a lot of patients that, they've always wanted to try meditation, or they dabbled in it and haven't gotten very far. And so they continue using the skills not only for helping their IBS, because it helps them in their life in other ways too. So again, there's not a lot of risk, or not a lot to be lost in terms of giving this a try. So, I think, I'd encourage people to kind of open their mind to it, and I think they would be pleasantly surprised.
Mm-hmm.
Gosh, in this crazy world of high stress and high pressure, it sounds pretty inviting to take some few minutes to imagine yourself on a beach with warm waves and sunshine, right? So that sounds very nice.
It's something we can all benefit from.
Absolutely. Absolutely. Tim, I have to ask you a final question. Have you tried Gut Directed Hypnotherapy?
Absolutely. No, and it's funny. We hear this from patients all the time. And I had the same feeling after that first session. We so often hear, well, I don't know if this is going to help me or not, but I do feel better. My emotions have just been lifted a little bit. And I felt the exact same way. I don't know what long-term impact this will have, but that was a nice, relaxing 25, 30 minutes I just spent.
Yeah. We heard from Jeffrey Roberts, our IBS patient, on the webinar too, that this was, before Regulora was available, had utilized gut directed hypnotherapy and felt it to be quite beneficial for his symptoms, and even just for his general relaxation, like you both mentioned. So I think there's a lot to take away from using it. So with that, we will call it a day. Thank you so much for joining us, Dr. Kinsinger and Tim. Appreciate your time today. If any of our listeners, both patients or providers, have any questions about gut-directed hypnotherapy in general, or about Regulora, shoot us an email. We'll be happy to get you those answers. And until next time, have a great rest of your day. We'll see you in February. Take good care, everyone. Bye now.
Join us again next month for another episode of Tuesday Night IBS. And be sure to follow the conversation on our Twitter page at #TuesdayNightIBS. We host live Twitter chats on the second Tuesday of each month at 7 p.m. Eastern Standard Time with our monthly guest, and encourage you to join in on the conversation. In addition, check out our page on Facebook at Tuesday Night IBS and find video presentations provided monthly by our guest experts to further guide our learning and conversation about these important topics. See you next month.